Thanks for the introduction, guys, and hope everybody's having a good day throughout the state. It's pretty here in Duplin County today. So we will just sort of give you guys an overview of Cpesn, which stands for Community Pharmacy Enhanced Service Network. And so we want to think about why involve community pharmacy. And so as you can see from this busy graph here, this was taken just from a subset of patients that CCNC, or Community Care of North Carolina, manages. And these are what we call our Medicaid patients, or our dually eligible, so they have Medicaid or Medicare. And so as you can see, just from all of the CCNC enrollees, most of the patients see the pharmacy twice as much as they see the primary care provider. And then as you move across the continuum, it depends on, as the patient becomes more high risk with multiple chronic illnesses, you'll start to see that they would potentially see the pharmacy quite a bit more than they would see their primary care provider or even specialist as they become more complex. So I think it's a good place to reach in and to bring in the community pharmacies into our interdisciplinary team as we move forward. So within that, back in 2014, there was a group of community pharmacies in the state of North Carolina that sort of came together to create what we call the Cpesn network. And it was the pharmacies who are willing to provide enhanced services and help coordinate care across the healthcare team. So it officially became a network in April of 2014, and currently, as of the end of December, we had 277 North Carolina community-based pharmacies. The majority of these are retail pharmacies, and this is an open network. So at any time, if you guys, as you guys listen through this presentation and identify some community pharmacies who may not be part of the network, please share those names with me or my colleagues across the state, and we would be glad to, follow up with them to see if they would like to become part of the network, because it is an open network throughout the state. So a little bit more about Cpesn, and what it is it's sort of trying to move from the conventional things that we think about a pharmacy doing more to providing more outpatient services, really looking at how do we help decrease total health care costs, how do pharmacies help reduce ED visits and inpatient visits, and work on those potentially preventable readmissions. And so through some ways of the services that these pharmacies provide are through home delivery that they may provide for our patients, especially in some of our rural areas across the state. Also, they have some med synchronization programs in which they would be able to fill all their meds at one specific time of the month, especially if there are some financial hardships the patients may experience. And that also does help with the home delivery side. Some of our patients do benefit from adherence packaging, and there are different forms of adherence packaging that the pharmacies may provide, so it would be good to check with those. Some charge, some do it free of charge, so it just depends on the pharmacies and what services. And also there are some broader services that some of the pharmacies may provide as well that you would be able to identify in the locator app that is available, that is, and we'll provide that later on, which it is available on the internet. And those broader services could be, some pharmacies provide vaccinations. Some pharmacies may have naloxone prescribing. They do DME equipment, maybe smoking cessation or nutritional counseling. So there's some other broader services that you may find. But the three that you see here that are listed as examples are typically what most of the pharmacies do provide throughout the state. So here's a little bit of a busy slide talking about it. As you see in the top left corner, you'll see the map of the Cpesn pharmacies, of those 277 pharmacies throughout the state, where they're located geographically. And then in the bottom right corner, you'll see the state of North Carolina again. It looks like it's divided into 14 networks. I am one of the network pharmacists for one of the networks, which is the Eastern, which is the light Carolina blue color. We cover 27 counties out here in the East, but I do have counterparts throughout the state, and there is a contact list of the network pharmacists that Rico will share with you guys, so you can have it at hand, and it also includes our contact information, so you can just give us a call. So with this, looking at, again, we talked on the previous slide, the adherence packaging, med synchronizations, mission immunizations. So with these Cpesn pharmacies, they do work very collaboratively with our, currently our CCNC model with care management to help provide more enhanced care coordination that we need. These pharmacies do take referrals, so if there is a patient that is in a specific area that may not be using one of these pharmacies, you can make a referral to these pharmacies, and there's a referral form that can be used, or you can just give them a call, and they would be glad to work with that as well based off the needs that are being needed by the patient. And some examples of maybe reasons to send a referral is if the patient maybe has poor understanding of their disease condition, they need more disease management. If the patient's using multiple pharmacies, multiple providers, more for that polypharmacy, that we can get them using one pharmacy, and that pharmacy sort of helps manage and helps those providers with that. And some of our patients do have very complex medication regimens. So really doing a thorough medication reconciliation, med review after a patient's hospitalization, and ensuring the patients are getting those meds. And there could be other things. We mentioned earlier about delivery services. You will see some of our patients have to pay people to take them to the pharmacy, or they can't get to the pharmacy. So that delivery service we have seen has been is a very good option that some of these pharmacies provide for some of our patients to really help with improved medication adherence. So I mentioned briefly about the team collaboration. So there has been times when one of the pharmacy staff may do a joint visit, maybe with you guys as part of this project, or with our care managers, helping with that and actually looking at some of the meds and going over with the patients there. So it just helps with that team collaboration. We want to look at how can we prevent barriers for medication that relate to medication adherence. A lot of times we do see with our patients, especially in this population, med adherence may have been some of the reasons that may have led up to having a stroke. So how can we ensure that they do get their meds and they are taking them correctly, so we can prevent maybe a follow-up ED visit or a readmission that we may have. So just remember also there is care management as part under CCNC as well for your Medicaid and dually eligible patients that you can make referrals to as well. So there is a Cpesn locator app that is available. I will include the actual link for that on an email to Rika when she sends out the contact list, so you guys can get that. But I will tell you, it's the address is locator.cpesn.com. Again, locator.cpesn.com. And if you do look at that, now Cpesn has rolled out to be Cpesn USA. And so you will actually see other states now that are participating in this project. And so you would just click on the state of North Carolina, and then it will take you to here. And so on the screen that you see here in the middle, it says enter or search criteria by pharmacies. So you could potentially type in a town, let's say Greenville, North Carolina, and then you can put within a mile radius, 5, 10, 15, or 20 plus miles. If you click 20 plus miles, that's going to give you all the pharmacies in the state. So you may want to narrow it down to 5, 10, or 15 miles, and then that'll give you more in that area of that town. You can just click search after that over on the far right, and once you click search, it will just bring up the name of the pharmacy. If you want to shorten your search based off of, is it DME billing, is it home delivery, is it adherence packaging? As you see in the middle of the screen here, you can also do that as well. And then it'll bring up the pharmacies, and then you can go in and see what services those pharmacies provide, sort of the broader services as well. You'll see a green check mark, or you'll see a red X that tells you if it's those services or not. So just any questions about CPESN? I think there's a good place for these pharmacies for some of our patients throughout. And again, with CPESN, it's any payer. It does not have to be just Medicaid or Medicare for adherence packaging or some of the other services that they may provide. It can be for any payer. So just keep that as a reminder.